From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hello, and thank you for coming to listen to the Psych Health and Safety Podcast. I'm Peter Kelly. I'm your host for today. Unfortunately, Hayley has an issue with broadband, so Hayley won't be joining us today. Obviously, I think it's very wet down south at the moment. Mind you, we both myself and my guest are up north, and we're used to the rain up here. If you'd like to introduce yourself, over to you, Edward.
Thanks, Peter. Yeah, I'm Dr Edward Lynch. I'm an A&E doctor by background and also triple certified lifestyle physician. I founded a company called the Wellbeing Doctors around 18 months ago, and we're starting to introduce best practice into the workplace to improve not only mental health, but overall health outcomes for staff, and also looking at how corporates can use that best practice to improve the policies and procedures that they bring in for their staff.
Okay, and so I'd be really interested in what makes an A&E doctor decide, okay, I'm going to go and start and do some work in workplace mental health and well-being. And it's not like the normal career path, is it?
No, not at all. And that comes with its own difficulties within the medical field. I think it's its own little niche where if you work in the medical field, the only thing that you do is medicine, and you just bumble along in your tracks, and you go on to become a registrar, consultant, and that is your pathway typically. So it comes with its own struggles trying to be entrepreneurial within the NHS, because the NHS is trying with NHS X, but it's typically not a very entrepreneurial setting at all. But actually started before I was an A&E doctor, so it started when I was a medical student. Prolific North actually did a piece on this, which I didn't expect. They published a piece around the history of the wellbeing doctors and me, and how we got to where we are today. And it started off with one of my friends and colleagues from school who killed himself during university. And I was at university at the time myself, and I just said, I spoke to my high school where we met, and I just said, look, I'm sure you've heard about our fellow colleague who's killed himself. Is there anything that I can add from my position that would help your current student base? And they said, yeah, okay, well, that sounds good. Let's jump into a meeting and see where it takes us. And then we started doing a couple of assemblies, and it went down quite well with the students. So they said, okay, well, that was good. Could you potentially do one for the teachers and the parents? So it was like, well, okay, let's have a look at that. And the content was adapted slightly, and that was really the underpinnings of the journey. And it kind of snowballed from there, and could see that there was a market need for somebody to just speak truthfully about what is happening on an individual level in terms of health and well-being, and coming at it from a perspective which is based on the data rather than opinion. So this is kind of what we've done, or what I've done for the past 6 years, and tried a couple of times to make a commercial living out of that, but it hasn't gone terribly well. But that comes with its own lessons. So that's how it started. And then it's only been reinforced by the work that I do in acute trusts, whether it be, I've done my time on intensive care, cardiology wards, and now work most of my time between A&E and intensive care. People live generally very unhealthy lives in the UK, where they don't understand what's going into the bodies. They don't sleep well. They're really stressed. They don't exercise particularly well. They're overweight. They take loads and loads of medications, which arguably they could have prevented being on in the first place. You add all of those things together, and you're presented with a person who has multiple comorbidities at the age of 45, and that is a big problem, especially when it comes to work. So from a medical standpoint, I've understood how we treat it to the gold standard way, pharmacologically or surgically. But I think it's the bit before that which matters most, which is how that person's actually living, because that's what's put us in this position in the first place. So if we can just step back a little bit and improve that person's lifestyle before we end up with those multiple comorbidities, that is a much better place to be. So it started off purely in the realm of mental health, but then as that discovery's gone on, I've realized that it's the multifactorial approach and the intersectionality of lifestyle which predicts how well or unwell that person's going to be. So that's where we are, Peter.
What role do you see, Edward, with the organisation? Because if the organisation and the individual are there, and there's a responsibility, as you say, on the individual to improve lifestyle factors that improve comorbidity. But what is the role of the organisation in that? If we think about the NHS and the wellbeing hubs, etc., what do you think? Because obviously, you can put somebody back into a toxic environment who can have all the right health sort of behaviours, but actually the workplace they're in is not healthy. So what would you say that both the positive and the negative is of what a workplace can do to a person's physical and psychological health?
The split between where the responsibility lies is hard to accurately get down to a precise number. So to say it's a 50-50 split or an 80-20 split, who knows? For me, the bulk of the responsibility lies on the individual. I think corporates do have a job to do, but equally, corporates, I don't like the phrase corporate, and the reason for that is corporates are made up of individuals, and it's the individuals that matter out of that. So it's about how do we distill a culture across those individuals. Corporate kind of removes the responsibility from any individual to say, this is what we're going to do about health and well-being. So it can get lost in that corporate architecture, which I'm not fond of. Now, the business as a whole, which is comprised of the C-suite or the HR managers, they do have a responsibility to ensure that there are the right policies and procedures in place and the culture's looked after to a point where the individuals can thrive. Now, if you look at the NHS as an example, that is arguably one of the most difficult environments to look after a staff member compared to any other corporate. And the reason being is you're already set up for a very poor baseline. You're shift working from day one. You're shift working in a dangerous environment, and people who work 9 to 5 in an office are considerably more safe immediately. That corporate structure, if we want to call it that, is so much safer than an NHS setup already. They're not shift working, so the impact on their sleep, their circadian rhythms, how they regulate their mood, and then that ties into what they're eating, how they'll exercise, their interpersonal relationships, spending time with family and friends. All of that within the NHS is so difficult to get right due to shift work that the baseline immediately, you would assume that the baseline health of the staff in the NHS would be so much lower on that alone. It is often reflected, but whether it's due to shift work alone is hard to say. It's also a dangerous environment in the NHS. You've got hostile patients, you're surrounded by disease, you can get multiple needle stick injuries. There's hazards absolutely everywhere in the NHS. So that does mean that the individuals themselves working in that environment have to take it on to a degree in order to mitigate those factors. So there are guidelines out there for shift work, how you go into shift work, so when you start a night shift, what you do during the night shift. So if you're doing 3 or 4, what you do in between those night shifts, and then how you come out of a night shift. Equally, there's guidance on late shifts, early shifts, twilight shifts. it's on that guidance is there, and the NHS do provide that, but it's on the individual to actually do it. And this is what I mean. If the individual does not do those things due to variety of factors, let's say they've got kids at home, or they want to go to the gym at a certain time, or life and routine often gets in the way, or current routine gets in the way of what they could do better. It's on the individual to actually do that. And the corporate can only do so much to introduce those policies and procedures. So it's a really difficult balance, Peter, but I think there's responsibility within both parties. Fundamentally, however, the individual needs to take on their burden and look after themselves in a way which is appropriate to their situation.
Yeah, I mean, it is, even when we're assessing corporate stress, we look at what's the role of the individual in that, in individual elements that are there. The interesting thing, Edward, is if you look across the country, the NHS is the biggest employer. It also has the highest rates of people reporting work-related stress as based on that work makes them ill. And so even with all the obvious hazards that are there, the fact that there are wellbeing support in most trusts, NHS staff still report that they feel overwhelmed by some of the systems and processes. Yeah. So even we have this conversation, even though you have these, we want you to have lifestyle factors that make sure you come in healthy. It might be that actually having, as we've said, having those, we could potentially, you still have these people that find that the overload of work, I mean, obviously, as an A&E doctor on a Saturday night and a Friday night, it's chaos in some respects, isn't it? That's an organisational pressure. So I guess, and you want your people to be as strong as they can be, yeah. But they are ultimately going to be influenced by a wave of pressure that comes in.
Yeah, I do think though, Peter, what can the NHS do? A&E is a stressful environment, if we're taking A&E as an example. And how does the NHS make that less stressful? It's like, it's almost akin to a war zone. Obviously, we're not getting shot at, but it's, how do you make a war zone less stressful? Being in the war zone for the minimal amount of time as possible, yes, that helps. So what we have to remember is people here have a choice. They don't have to work in this environment if they don't want to. They can work somewhere else. Personally, I thrive off it. I like the adrenaline-fueled working circumstances. But if people are getting stressed out by it, there's plenty of other opportunities. The nurses within A&E are, again, arguably some of the most highly skilled nurses there, because they have to do everything. They have to do almost all of the procedures, bloods. They have to deal with multiple issues. It's not just psych. It might be urology issues. It might be gastro issues. They have to have a baseline knowledge across all of it. So they're really, really, really sought after staff, and they can pretty much work wherever they want, these people. So I think the NHS can't do anything about that situation, because it is akin to a war zone. Apart from staffing it with unbelievable levels of people, that stress is always going to be there. And when you start thinking about, again, that intersectionality of how we run a department, unfortunately, finances do become a part of that. And it's just unreasonable to assume that we could have an unlimited number of staff.
Yes,
now,
of course. Absolutely.
What we need to do is reduce the amount of people coming in through the doors, because the population is so sick due to their lifestyles that we have a huge wave of people coming through the doors. And it's not just Friday and Saturday nights, Peter. It's, we're in the middle of summer here, and at 12 o'clock on a Sunday, midday, we had 170 people waiting to be seen, and there was 10 doctors on. And you're like, that's where the stress comes in. But you have to just plod on with your work. You can't run around flapping thinking, oh my God, there's all these people to see. You just have to accept there's only so much work that you can do, and the weights will go up, unfortunately. But I think the things that the NHS can do is they can put in fairer rotas. They can put in little extra hours either side of night shifts. They can pay you fairly. There are things that they can do, but they can't necessarily, as an individual, trust. And they're the people who employ you. How are they going to change how many people come in through the front door? Because that dictates your stress.
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all Flourish DX Academy courses included within the Flourish DX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with Flourish DX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
No, exactly. I mean, it's because you have that open door, sort of that sort of approach. One of the things that you look at when you look at what you're doing through the Wellbeing Doctors, you're very evidence based, yeah. So your approach to tackling well-being and workplace mental health is around the evidence. Where do you think there is good evidence, and where do you think there is the need for more evidence when it comes to workplace mental health and well-being? That's a great question, isn't it?
It is, Peter. I think generally in the UK, there's almost zero evidence base in what we do. I look at what businesses offer, what employee well-being businesses offer corporates, and it is unbelievably poor, the offering. And the things that upset me is that the guidelines have been published and set based on 50 years worth of research, and it's not integrated. And I know why it's difficult, but if we're not doing that, then who decides what we're measuring? These workplace wellbeing companies come in, and I always sit there and think, what does good look like to them? They have no idea what good looks like. And then you think, if you don't know what you're measuring and you don't know what good is, if you're putting in an intervention and it creates an output, how reliably are you going to be able to measure that? Because you don't know what you're measuring and you don't know what good looks like. And then by what standards are these people experts? I think the whole thing is just unbelievably dangerous, and it's people's health fundamentally that we're dealing with. So for me, it has to be evidence-based. It's the only way for us as a community of lifestyle practitioners or well-being interventionists. It's the only way for us to actually look after people safely, because I have contributed to the evidence base in a very minimal way, but the research has been done over 40, 50 years, and the data is in. We understand to a reasonable degree how to look after a person, and it will continue to get better. Of course it will. But, now the evidence base that we currently have access to isn't being used by 99% of the workplace wellbeing offerings. It just baffles me.
Yeah. But many of those have actually just grown up over a period of time, during certainly over the last 10 years, we've seen a plethora of these organisations coming. Some have got evidence, but a large proportion, as you said, don't have evidence based, and it's you'd be familiar with Cochrane reviews in terms of looking for the evidence of impact and performance and effect. I've tried to encourage where I can organisations to assess the impact of what they do, and to do that right from the outset. So just to sign in evidence base right from the outset. And if you're going to do an initiative to be proactive on mental health and well-being, then you need to be designing in the assessment of how well it did, or what did it have impact, and you need to determine what impact is, etc., etc. So what is fascinating, as you'll know, the reason Cochrane came about was a heart procedure was undertaken for about 15 years that was thought to be completely effective. And actually, when they did a systematic review of that procedure, they found more people were actually dying. The initial reason why the Cochrane reviews happened was, well, what else is happening that we assume is having an impact but might not be having an impact? So that's the fascinating bit of it for me. Yeah. You need evidence. I feel evidence is fundamental to making those decisions. It's interesting, because when you look at psychological health and safety, where we're talking about how people are essentially protected at work from things that might potentially cause them a problem, we're looking at it from an holistic approach. So it does include physical, psychological, and mental sort of health. How do you find that when you go to those external to the NHS, to an organisation, how do you present what you're doing, which is an holistic approach, in a way that gets them engaged and gives them impact? I know you've developed heavily on the tech side, haven't you? Mm-hmm. You put some tech resources in there. So
are you asking, how do we create buy-in from the organizations? Yes. Is that the question? Yeah. I think, again, it's no singular factor. It's the entire thing. They need to understand how it impacts them as a business. It's difficult. I'm always supportive, very supportive of the individuals. And for me, that is the single most important aspect of all of this, just as a disclaimer and to make that clear. On a business level, however, they do want to know the financial impact, the productivity impact, how many days off sick there are, and to understand that to a reasonable enough level that they can plan and understand if they need additional resource here or there. For example, if you could accurately predict when somebody's going to go off sick because of the current mental health status of that individual, that allows that business to plan and resource appropriately around that. Now, in an ideal world, obviously, you just look after the individuals better, or you enable them to look after themselves better. That's probably a better way to phrase it. It is difficult to create the buy-in from a corporate because they're most bothered about, unfortunately, box ticking and finances. So box ticking might be sustainable development goals, which are set by the UN. Or you see a lot of companies now moving towards B corporations, so benefit corporations. There's a lot of procedures and policies that they need to set up as a company in order to hit those goals. So, for them, they want to certainly look good and look attractive to new talent. And they will also want to understand what the financial impact is on their business and be able to plan appropriately. So having those discussions with corporates and understanding how they're set up, where the teams are based, what they think the current sickness absences, presenteeism rates, what the cost is, and then looking at a value equation as to how we can help them. That's often how we create buy-in. But, I go back to what I said first, which is the individuals within their business, they are our priority. We have to look after them fundamentally.
Yeah, and the organisation does have a responsibility, to facilitate that possibility that they can sort of stay healthy. Well, not sort of stay healthy, but I guess I'd be interested to see, where do you see the future of mental health in workplace going? Okay, given that there is a rise in the general health and well-being movement, you can't not switch on your TV without somebody talking, or Instagram, or any other TikTok, where we got things on well-being and health, and that in particular the individual-based approach as opposed to organizations. So what I'm trying to say is, and I will always come back to organizations as well as the individual, I would like to see a rise in organizational stuff, equally with the significant rise that we've seen with individuals. But where do you see it going in the future of mental health in the workplace?
It's certainly about self-empowerment and control on an individual level. They need to be able to understand their health quickly and do something about it now, which is what we offer as the wellbeing doctors.
Mm-hmm.
I think it will be digital tools will be used, but not used in a social media type fashion, because what we've seen, the evidence base within social media, what that highlights is that it actually isolates people more than it connects people. It increases the amount of stress and depressive feelings that people have. So, you mentioned TikTok and Instagram. I think the markets will slowly shift away. In the slightly older generation, it's already happening. People are moving away from using social media as much because they recognize the detrimental impact it has on their health. But I think that the whole market is moving towards self-enabling digital tools that provide visibility of what your current health status is, in order that you can then improve it. And it's based on best practice. So where is my health at right now? These are the recommendations that are set for me as a 35-year-old female whose stress level is currently, let's say, 70%. My blood pressure is X, my blood results are Y. I have a family history of this, my underlying conditions are these, and I'm on these medications. Therefore, these are the recommendations for me as an individual. And that's the thing. It's not about grouping people into whatever groups you decide to put people into. It's not about that. The most important thing is we treat people as individuals. Because as I've just highlighted there, that example of a 35-year-old female with X, Y, and Z, that is a hyper-specific situation. And that 35-year-old female can't be grouped with the other 35-year-old females, because they will be so different when you factor in all of the features of those people, So it comes down to that individual self-empowerment and control, giving that actual human being control over their health and well-being, rather than trying to do it on a mass level. That's where it's heading to.
Yeah, and I guess that that is how it will be across the NHS. I mean, as we sort of continue to struggle in that. So what we normally do is we leave our listeners with one last final thought, something that you feel is important for them to know, specifically around mental health. And that, so what would be, if you have this opportunity, what would be the one final thing that you would say to the listeners that they need to do to sustain and improve their mental health? And what does and what do you see as the that the organisation can do as well. Good luck.
Yeah, okay. Again, it depends. I can't possibly give generic advice to people because, as we've just discussed, it's the intersectionality of all problems that coming together that makes that individual unique. So, the advice would always be to sit down and reflect on where you're at right now. And the things to think about are, am I happy with my career? Am I happy with my family? Am I happy with my current friendships? Am I potentially doing too much socializing, not enough socializing? Do I feel isolated? Am I exercising enough? What's my sleep like? Am I eating good enough foods? Is it processed? There's loads and loads and loads of things that we get them to sit down and think about. So they're probably 10 factors that you can think about. The remote, that's not exhaustive whatsoever. But my advice would be to sit down and reflect where you are now and think, what things am I doing wrong that aren't serving me? And ask yourself that question honestly. It might take a while to create an answer. You might have five or six things straight away, but write them down, think about it and write them down, and then put plans in place to fix it. That's what we should all be doing all of the time. And I can't possibly say, you must do this. You must eat well, for example. Obviously, that's fine. That's great. But what if I'm having a highly nutritious, zero processed diet? It's like that advice doesn't apply to me. So reflect on where you're at now. Think about all the things which are potentially impacting your health and well-being, career or otherwise. What is not serving me? And then put plans in place to fix them.
Yeah. No, I mean, absolutely. That's sort of important. One thing we didn't really cover was you offer a range of services, don't you, in terms of the lifestyle. So it is across the spectrum of trying to support people, which is really, really important. Well, thank you very much for that. And what we normally do now is we just remind our listeners that they can listen to this podcast on all of their various platforms that they have, including YouTube. And we hope that everyone has a good time listening to this. Look forward to seeing and hearing from people through the LinkedIn. And we look forward to the next chat.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.